Hi guys, this is Guto Nyang'au. I'm a tutor at a medical college in Nairobi. Welcome to Healthcare Assisting, Nursing Assisting, or CNA lecture series. I'm making these lectures for my students and for you and anybody else that might be interested in what we teach. So we are going to start our series in healthcare assisting. We will have a little bit of introduction of what is healthcare assisting, its slight history, its importance, roles of an healthcare assistant, and some ethical considerations and legal issues here and there. Just to make you understand what the course is all about, it's an introductory lecture that will make you have a broad scope or about healthcare assisting. So let's begin. Sorry, a little bit. So introduction. So what is healthcare assisting? Just from the word healthcare assisting is composed of two terms, health and assisting. So literally healthcare assisting or nursing assisting, we are going to learn that healthcare assisting, nursing assisting, and CNA literally means the same thing. So healthcare assisting has two terms, comes from two terms, health and assisting. So it literally means assisting healthcare professionals in literally what they do. So healthcare assisting is a field involving support to healthcare professionals in providing patients care. Just as the name says, as the name goes, it's responsible for assisting healthcare providers in the provision of patient care. So it's just assisting healthcare professionals in what they do, irrespective of what kind of healthcare professions they are. You can assist a dentist, you can assist a physician, you can assist a clinician, you can assist a pharmacist, just anybody in the medical field that is referred as an healthcare provider. Nursing assisting is closely related to healthcare assisting, almost the same thing. But the difference is nursing assisting, a specific role within healthcare assisting focused on supporting nurses in delivering medical care. So healthcare assisting has got nursing assisting inside it. We said in healthcare assisting, you assist medical professionals in performing their tasks, including nurses. But in nursing assisting, you narrow down into only assisting nurses in their work. So I tend to believe that healthcare assisting is superior to nursing assisting, because in healthcare assisting you can assist literally any other medical professionals, including doctors, including nurses, including dentists, including pharmacists. But in nursing assisting, you are just restricted into assisting nursing in what they do. So you are like a personal assistant to the nurses. Let's get into the different terms that are used to refer to healthcare assisting. So literally, a lot of students come up with questions of, oh, I want to do CNA, I want to do healthcare assisting, I want to do nursing assisting. What is the difference? I'm coming out clearly to explain that just like if you studied in Africa today, I'm recording this video from Nairobi, Kenya. If you studied in Africa today and you went to, like, for example, UK, in Africa we do what we call CBC, that is competence-based curriculum, and in other countries they do different curriculums. So when you go there, you have the ability, having studied in high school in Kenya, in Rwanda, in South Africa, you can still go to those countries and still continue with your postgraduate degree. What do? They usually do what we call equation of certificates. You don't do the same things, but they are able to tell, is what you did in your country closely related with what we do in our country. So similarly, Healthcare assisting, as we have stated, whatever it is, it's called healthcare assisting. It's the same thing that exists in every country in the world, but only in different countries they will adopt a different name. For example, healthcare assisting is the same thing that is called certified nursing assistant, CNA, or nursing assistant in the United States of America. Is the same thing that is called healthcare assisting or support worker in the United Kingdom. Is the same thing that is called personal support worker or healthcare aide in Canada. In Australia, it's called personal care assistant or aged care worker. In New Zealand, it's called healthcare assistant or support worker. So literally, these names that we've stated below are the same thing. The healthcare assisting that you'll do in whichever country is the same thing, same curriculum, that it will be done in those countries but with different names. So the question that is usually raised is that, can I work in America? Can I work in the UK? You see UK advertising their work, or Canada with the names they use like CNA. It's literally the same thing. You can apply and qualify to work in those countries. It's just that it's the same thing, only that the name is different. And what is usually done is what we call equation of certificates. The same way you can leave Kenya with your KCSE certificate and go do your postgraduates in UK, in South Africa, in other parts of the world similarly. So it's still the same thing. Do not be confused that I want to do CNA only. CNA is different from healthcare assisting. It's just the same thing. It's similarly the same thing whether you go to every country. Some have primary school, high school, university, some in terms of classes. Other countries have them in terms of grades, but literally what is being taught is closely the same. So that is what I wanted it to sink into your mind, that we are literally doing the same thing. And you can qualify to either study and work in those countries. Core skills and competences. The core skills and competences, these are the skills that are required for an healthcare assistant, for a nursing assistant, for an auxiliary assistant, for a physician assistant. We've said those names means the same thing. So I will be using healthcare assisting or nursing assisting interchangeably, those names interchangeably, but I'll be meaning the same thing. So these are the skills required in this field. If you want to do healthcare assisting, these are the skills that you will be required to have. First of all is basic medical knowledge, understanding human anatomy, medical terminologies, and common health conditions. Why is that very important? You will be assisting healthcare professionals in taking care of patients, and you will be required to understand basic things, not in depth of them, but a little bit of them. You need to have a slightly deeper knowledge on these things that you're able to understand when we talk about the different parts of the body, because you'll be told, take this medicine, go and administer to the patient, inject it probably in the deltoid muscle. You have to know what the deltoid muscle is. You'll be told this is an oral drug, give it to the patient. You need to understand those simple things. So people that you'll be assisting who are healthcare professionals will be using medical terms here and there, but at least you have to have a slight knowledge of all this so that you do not float when assisting them. Patients care, you have to have skills in care of patients, assistance with personal hygiene, mobility, nutrition, and comfort. Literally, you will be assisting patients with what we usually call ADLS, activities of daily living. Those are activities that a patient cannot literally do, but could have been able to do if they were in their proper state of health. Yes, anybody else is able to take care of patients. Our mothers took care of us. We take care of other people, but you have to have a slight medical knowledge, or you should be advanced in taking care of a patient more than what a layman could have done. Vital signs monitoring. We have what you call vital signs. We will be doing a topic about vital signs, so I'll not get into deeper into it. Infection control. This is controlling infections, making sure that patients do not infect you, you do not infect patients, and patients do not infect each other. So generally you will be taking care of patients, but in an advanced way more than what a layman is capable of doing. Certification and licensing. A lot of people ask about certification and licensing. So for you to become an healthcare assistant, you are required to complete a training in a medical institution. Thereafter, you will receive a certificate. We have what you call licensure or licensing, depending on a country that you will be working. Some countries requires you, after completing training in a medical institution, you are required to get a license. So a license that will allow you to practice. This one varies from country to country. So what I'll encourage is, whichever country you are or whichever country you will be working from, make sure that you update yourself on the legal framework of that country. Key training areas. What will we be training you in healthcare assisting? We will be training you on patient safety. Remember, you'll be taking care of a patient. Take care of a patient, make sure there are no emergencies, or when emergencies occurs, you know how to respond to them. Make sure the patient is comfortable. That is what generally we are calling patient safety. Medical procedures. There are simple medical procedures that you will be assisting in doing, such as collecting samples, administering medication, wound care, and such, because literally that is what you'll be assisting here and there, but highly under supervision. Ethics and confidentiality, because you will be working under the health sector, or you will be part of the healthcare workforce. Then we will teach you about ethics and confidentiality. Emergency response will also be taught, how to respond to emergencies. As much as you will be taking care of patients, an emergency is bound to occur. A patient might be choking, a patient might be nose bleeding, a patient might have fall down, a patient might have had fractures, a patient might have had choking and such. So we also teach you how to respond before the patient received specialized care from healthcare professionals. Oh, that is a continuation. Sorry, it came at a wrong point. Those are the other names that are used for healthcare assisting. In Germany, it's care assistant. In France, it's nursing assistant. In Spain, it's auxiliary or nursing assistant. In South Africa, it's healthcare assistant. Already, I think we are at par with that. Focus. So the focus of healthcare assisting usually is to assist in the primary focus is on long-term care, patients that are in hospital for a long period of time. So working environment. So the other question that usually come up is, where do healthcare assistant or nursing assistant or as auxiliary assistants be working? So I want to demystify some facts, especially in Africa, that CNA or healthcare assistants only work in home-based care, that you go take care of old people, take care of the sick at home. That is not the case. If you've understood my explanation, my definition of what healthcare assisting is that you work by assisting medical or healthcare professionals in whichever setting. You can be assisting healthcare professionals in hospitals. That is number one. You will be on hospital being an assistant of healthcare providers. You can be in clinics such as outpatients clinic, assisting with 1, 2, 3 things. Transfer of patients, taking vital signs, administering some medications, advising some patients and such. Physician's office, for those physicians who have offices. You can also be working at the client's home for those patients that are undergoing home-based care. So I think I've already demystified that healthcare assistant, nursing assistants, auxiliary assistant, CNA do not only work at home. You have a wide scope of operation, just like any other medical professional. In fact, there is no single department in hospital that you cannot work in, including the theater, including maternity, including the surgical ward, including ICU, because your responsibility is to assist healthcare professionals. So wherever they are, that is wherever you will be, because you will be working under supervision. So the settings of your work are hospitals. I've explained what you can do in hospitals, in clinic, in physician's office, and in the client's offices, in the client's home, that is home-based care. So your responsibilities, the responsibilities of an healthcare assisting are as follows. We have what you call ADLS. You will be assisting the patients. Majority of the times, you will be assisting patients on what the healthcare professionals might not be able to do, or the simple things that the patient could have been able to do if they were well. Personal care, activities of daily living. You will be assisting the patients in bathing, grooming, dressing, eating, hydration, toileting, ambulation, and exercises. These are what we call the activities of daily living, what the patient could have done or could have been able to do if they were not sick. We usually wake up, bathe, eat, exercise, ambulate, move around, and such. So we will be assisting the patients in activities of daily living. Key skills that will be required: communication skills, effective verbal and written communication with clients, empathy, that is putting yourself into a patient's shoes. Adaptability is also important in healthcare assisting. That one simply means, adaptability means you have to adapt to the way of the patient. The patients you'll be taking care of them come in different shades. Some are calm, some are hostiles, some are noisy, some are just introverts, extroverts, and such, ambiverts and such. So you have to adapt to the care of different patients, because your presence is focused on serving the patients. So it's you who is supposed to be flexible on dealing with these patients. So responsibilities of an healthcare assistant assisting with daily activities. We have already highlighted that, because the main work of an healthcare assistant is to assist the patients in their daily uh, activities of daily living, and monitoring of vital signs and reporting. So assisting with daily activities, e.g. bathing, dressing, and grooming, we have called them ADLS, activities of daily living. Help with mobility and transfer of patients. Monitor vital signs. I've said don't worry about that. We have vital signs which as blood pressure, temperature, pulse, heart rate. We will study that in details. Reporting any changes, conditions to the healthcare professionals. So you will be the person that will be so much close to the patient compared to the healthcare professionals. So most of the times you are acting as a bridge between the patient and healthcare professionals. So you will be reporting anything suspicious or anything that is not going right, or you will just be giving progress of the patient, offering companion and emotion to the patient. You will be there to offer these patients emotional support every time. Encourage social interaction. You will be there to interact with the patient. So you will just be acting like a parent to these patients, just how the parents do. Take care of the kids. Help the kids do what they cannot do. Just in case there is a problem, report. Just how the mother will come to hospital and report the condition of the kid. This is what has been happening with my kid. That is the same thing that you're going to do, because healthcare assisting literally runs like nursing. I don't know, you guys know nursing, and you know the history of nursing, how nursing began, how Florence Nightingale pioneered the development of nursing. It was so nice of her. Read that history, then you will feel the importance of it. We've said we have what we call title variation. Just in different countries, we are moving away from a lot of things. I'm just trying to make introductions here and there so that because before we start getting into deeper things in the curriculum of healthcare assisting, you will have understood a lot of things. So we have title variation. In hospitals or clinic settings, we have other hospitals whereby initially we are all used to calling the people we serve patients. Nowadays in other hospitals, they refer them to clients. So you'll hear doctors and nurses saying, I have a client. Why do we call them clients or customers? This is because we say nowadays healthcare is just a business like any other. We provide services and the patients are the consumers of our services. We are the providers and they are the consumers. That's why we refer them as clients or customers. Then in other hospitals, they will be referred as residents. Then generally, what goes around the world, they are usually called patients. Okay. So sometimes you will be called a patient care assistant or a technician. So you two will have different names. Importance of healthcare. What is the importance of healthcare assisting? Think about it this way. If you've ever gone to hospital, you will realize that doctors and nurses rarely have enough time with the patients. They don't have enough time to serve the patients individually. So they usually come because they have a lot of patients to serve. So healthcare assistants comes to act as a bridge between the healthcare providers and the patient. You will be spending time in close proximity, closer to the patient. So you will be able to get a lot of information from the patient. You will be able to report a lot of progress, either in the positive or the negative direction from the patient. This is like having a nanny in your home that takes care of your kid. You have a good nanny, then your kid is going to have a soft life. You have a bad nanny, then your kids are going to have a bad life. Because probably as parents, you are not home at every time. You come at night or in the morning, you come at night, then go in the morning. You go working and come back. So the nanny is the one to respond. Your kid is no longer eating well. Your kid is misbehaving. This is what is happening with your kid. So healthcare assistants also come in such kind of a position to act as a link between healthcare providers and the patient. So what is the importance? It improves the quality of life, enhancing the quality of life for elderly clients through compassionate and skilled care. You are there to attend to your patients directly. Support, providing essential support to clients and their families, ensuring comfort and well-being. So imagine if doctors had to spend time doing all these things. I don't know how many patients they will serve for a day. So this is literally what healthcare assistants are coming to assist with. So the primary role of an healthcare assistant, apart from the other roles that I've mentioned, they provide direct personal care of the client, referred as a resident. I've already said a resident and a client and a patient are terms that can be used interchangeably. So they provide direct care to the patient. What doctors cannot do, a doctor cannot come to bathe you, a doctor cannot come to feed you, because now they deal with what is critical. They can only come to check your progress, administer medication, do surgeries and such. Nurses too used to do this, but they are also overwhelmed by work. So nurses will be supervising you too in providing direct care to the patient. So we normally don't have time to do these things to the patient. So healthcare assistants are being trained to do this. It's slightly a new role that is coming up very quickly, and it's improving the quality of healthcare. Big ups to the healthcare assistants that are already in the field. You're making the patients feel loved. You're making the patient have the comfort they deserve. You are having the patient feel as secure as possible. So procedures, facilities procedure, follow procedures outlined in the facility manual under supervision. So you can be able to do some procedures. We already said administration of medication, cleaning of wounds, enemas, transfer of patients, discharges. So you will be assigned majority of the work. Measurements and observations. There are things that you'll be able to do. Vital signs measurements, we have already said. Other measurements, you can record height, weight, triaging, what you've literally seen, what you call triaging in hospital. You can also be able to do that. Specimen collection are things that you can be able to do. Infection control, you also have a critical role in ensuring that infections are controlled wherever the patient is. You make sure that patients do not infect each other, you do not infect each other, hygiene is maintained and such. Sometimes you might not be responsible for probably cleaning the room and doing such, because that one is usually done by some other staffs, but you can have a responsibility of really guiding them or making a supervision of them. Environmental care and control, you will have a responsibility to care about the patient safety. You will be responsible of ensuring there is ventilation in the room, the lights are not too strong, the noise is not too much, the temperature is not too high, the house is just comfortable. Just like the way you take care of your kids, you have a small infant, you are responsible for their care. That is similarly the same things that you will be doing in healthcare assisting. Client's ambulation and movement, you have already said you will be assisting the patients in ambulation and movement, but literally I want to emphasize that it's not that you will be assisting patients in their movements. It depends on the severity or the severity of their illness. Patients that can be able to ambulate freely, you will accompany them just to ensure they do not fall, or because patients can really get dizziness around and such kind of things. Exercises, you will be assisting patients in exercises. We have what we call range of motions to improve their body strength and muscle functions. So we will have a lot of roles here and there. You will assist patients in movement, in exercising to ensure that their muscles and bones remain stronger. Other responsibilities that you'll have: protecting the residents' rights, that is the client's rights, they have their own right, ensuring privacy, confidentiality, and dignity of the resident, adhering to standards, follow safety rules and comply with legal ethical standards, adhere to agency policies, client safety and well-being. So you'll just have a lot of responsibilities. So patients have got responsibilities such as autonomy, confidentiality, the right to refuse some sort of treatment, ensure privacy, make sure that the patient's privacy is adhered to. Adhere to standards. Every country have got standards of care that should be adhered to. So communication, you will also have a role in communication. Communicate verbally or in writing with client, visitors. So you will be communicating with the clients to get information, with their family on the needs of the client, with healthcare providers on your observations and such. Scope of practice. So we have what we call responsibilities are confined to those specified in the job description. So usually when any work is being advertised or any job, you'll have a work description. It will say if you apply for this job, these and these will be your responsibility. So depending on the contract you have with your employer, you will restrict yourself into the terms of your contract. Some things might be included, some might be excluded. Job limitation. What is the limitation of healthcare assisting? Just from the term healthcare assisting, I'm still making an analogy of a nanny. If you have a nanny at your home, your nanny is your assistant. What are the limitations of your nanny? The limitation is majority of the things your nanny does, she has to consult you, or they have to be directed. What she cooks today, it's you to direct. If she decides to do contrary to that, she has to consult you. So similarly, you are an healthcare assistant. Everything that you do should be under supervision, and you should have somebody that is directing and approving what you do. Though generally there are things, normal things, that you don't have to be supervised on. So we've said the greatest limitation, you work under the direction of a licensed nurse or a doctor. Responsibility limited to those specified in the job description. We have already said that. Limitation include giving medications, taking orders from doctors, and performing prohibited procedures. Consult immediate supervisor when to ensure about any functional task. Adhere to the adage, do not harm in practice. So you have some limitation. Every practice, every scope has got every specialty has got their limitations. So not only you. So those are some of our beautiful daughters in our college. Self-responsibility. So you have a responsibility, wear protective equipment, use effective body mechanics for lifting clients, maintain a safe workplace, organize work to conserve energy, and lead healthy lifestyles. So dependability, demonstrate commitment by arriving to work on time. Those are just some few factors here and there. You should also be considerate in your work as an healthcare assistant. So personal qualities that you should have as an healthcare assistant. We have honesty. You should be honest in what you do. Make sure you're trustworthy, caring, and you have exemplary caring characteristics. So for you to be a good healthcare assistant, you should have exemplary caring characteristics, not only from training. Naturally, we have people who just love caring and taking care of other people. Then you are suited well for healthcare assisting. You should also be accountable. A mistake you make, you will be accountable for it. Respect, you should have respect. Respect other people, respect your clients, respect healthcare professionals, respect other healthcare assistants. So we have what you call collaboration with other healthcare providers. These are examples of people you will be collaborating with. So when we say people that you will be assisting or people that you will be collaborating in the care of patients, you do not only work alone or assist patients alone. You will have other people that you will be assisting here and there. We have nursing staff. We have technicians, whether laboratory technician, therapist, whether occupational therapist, whether yes, occupational therapist and such. You have healthcare providers, physician, you have dietitian, you have social workers, you have clergies. So all these people will be getting in the care of patients in where your limit has reached. So like a patient that has got lifestyle diseases, you might require the assistance of a dietitian or a nutritionist. A patients that are recuperating from different injuries and need to be rehabilitated, you might need the assistance of therapists. Some patients are so religious, and in the holistic care of patients, we also care about the spirituality of patients. So you will need the assistance of clergymen and clergywomen. That is the end of lecture 1. So kindly, if you felt that this information was helpful, kindly subscribe to my YouTube channel. If you have anything, probably you have a reservation, you have a question, you need to critique my content, I'm free for that. My email is on the cover page. My phone number with Kenyan codes are also there. So you can also reach me on other platforms such as Instagram, Facebook, TikTok, and any other upcoming social media platform. I hope this information was helpful. Have a good time.